Hey, my name is Dr. Valaga. I'm going to talk about some of the health benefits of eating raw garlic today. Garlic has been used in traditional medicine for hundreds of years. The Egyptians used it in 1500 BC to treat diarrhea. The ancient Greek physicians Galen and Hippocrates prescribed it to their patients. Chinese, Japanese, and Indian healers prescribed it for respiratory, digestive, all types of different ailments. Today, 80% of the world's supply of garlic comes from China. We're going to talk about some of the active chemical structures in garlic that gives us all of its health benefits. The primary one is allicin. There's also diallyl disulfide and other diallyl structures. The chemically active group in here is this sulfur structure. It's what gives allicin its unique pungent smell and also its activity. Garlic has been shown to have beneficial effects on the heart. It can decrease blood pressure, both the systolic and the diastolic blood pressure. It can decrease total cholesterol in patients with high cholesterol. It can also lower the bad cholesterol. It can also prevent adverse cardiovascular outcomes. There was a study in India with 400 patients, half of which took garlic, the other half did not. Basically, the patients who took garlic had fewer heart attacks and strokes. Garlic has also been shown to have anti-cancer effects. In the lab, there are compounds in garlic that have been shown to kill brain cancer cells, specifically a type of brain cancer called glioblastoma. In China, they've done population studies that have shown that garlic can prevent prostate and gastrointestinal cancers. It's not just in China that these studies have been done. In San Francisco, they did a study that showed that eating more garlic decreased the risk of pancreatic cancer. Also in Iowa, the Iowa Women's Study showed that women who ate more garlic and foods rich in allicin had a lower risk of colon cancer in the distal colon. Garlic's been also shown to be beneficial for the immune system. There was a prominent study done that showed that groups that ate garlic had a more than 60% chance of more than 60% lower chance of getting a cold. Also, if they did develop a cold, they recovered 70% faster than the group that did not eat garlic. Garlic's been shown to have potent antiviral, antibacterial, and antifungal effects. There's a specific type of bacteria called Campylobacter. Garlic's been shown to be 100 times more effective at killing that bacteria than traditional antibiotics as well. It's beneficial for women's health. There was a twin study of more than 1,000 female twins that showed that the twins who had more allicin and garlic in their diet had fewer cases of osteoarthritis. Garlic can also prevent women from having spontaneous preterm delivery, although for that the evidence is still a little bit controversial. Garlic can also prevent diabetes. There's been some research that shows that garlic can decrease fasting blood glucose levels in type 2 diabetic patients and can also decrease insulin resistance. The medical community is not in full agreement though, so this is a little bit controversial. Garlic's also been shown to protect against acute and chronic alcohol-induced liver damage. There's been a couple of studies that suggest this. However, again, the medical establishment is still somewhat undecided, so it's still controversial as well. All of the benefits that we discussed are evidence-based. They're based on either controlled, randomized clinical trials or on prospective observational studies. Although garlic has beneficial effects on the heart, its anti-cancer effects, it's beneficial for the immune system. There are some adverse effects, obviously, like it can cause bad breath, aka halitosis. If you have food allergies, you shouldn't obviously eat garlic. It can also increase the risk of bleeding, especially in patients who are taking a blood thinner. So if you are taking a blood thinner, you might want to talk to your doctor before eating raw garlic. If you have any questions, feel free to reach out to me. This is my email. Here's a list of sources I used. It's not extensive, but if you go to this article, it's basically a summary of what I just talked about, and it will have all the sources I used. Hope this helps, and Hopefully, this inspires you to eat more raw garlic.